Hi, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is accepted at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Faris Yamin. Dr. Yamin is a licensed plastic surgeon in Beverly Hills. Dr. Yamin specializes in rhinoplasty, facial aesthetics, and body procedures. So, Dr. Yamin, today we're talking about under-eye dark circle correction. And can you first tell me what is under-eye dark circle correction, first of all?
So it is actually a wide spectrum of changes in the skin underneath the eye. And, they're always addressed as, I have a little bit of discoloration or circles underneath the eye, but sometimes it's actually not a skin discoloration, it's mostly a skin thinning. So the skin underneath the eye is one of the most thinnest, most sensitive skin that we have in our body. It has a very thin collagen layer underneath it. However, also has a lot of blood vessels that's behind that collagen layer. So if the skin gets too thin, this blood vessels becomes visible and gives that kind of purplish hue, if you will, that will look like a darkened skin. So that is usually thinning in the skin. But sometimes also you have a little bit of a deflation there between the fat pads of the cheek and the transition to the eyelid, and that creates a tear trough. And that shadow from the tear trough can be casted on and also look like a circle underneath the eye.
So I know there's a couple options when addressing your under eyes. So let's talk about dermal filler first. And what exactly is that?
So dermal fillers, they are hyaluronic acid. We inject them in a lot of places, lips, cheeks, everywhere. They come into different flavors and different types. The finest of these hyaluronic acid fillers can be placed in places underneath the eye. But again, you have to be very careful, and you have to listen to your doctor and your injector to what you are actually trying to address. Is the reason for it skin damage? Is the reason for it collagen, thinning in the collagen layer, or you have the deflation in the tear trough? If you have a deflation in the tear trough, then you can actually blend it in with the cheeks, and you can address it with the filler.
So if you were going to opt for fillers, how long would they last?
Most hyaluronic acid fillers, they don't last more than 10 months at maximum. Some can be a year, but mostly around 8 to 10 months.
And so I know another option is laser resurfacing. So can you tell me a little bit about that?
So laser resurfacing addresses the skin damage and the fine wrinkles that's there. Obviously, one address the deflation or the tear trough, one address the thickness of the skin or the collagen layer, but it can stimulate healing into the skin. So it can address these small little fine wrinkles. It can address the skin damage. It can, depending on the type of the laser and the depth of what you're using, or if you're combining with other treatments like microneedling, you can stimulate production of collagen and can make the under eye area look better and more youthful.
Is this a painful procedure?
It is more or less painful. I mean, it's not about the pain. It's about having your patient, accepting the fact that you are actually addressing the under eye area while you're awake.
Okay.
So that's if you have to you make sure you calm your patient and you apply enough, pain control medications. But it's mostly the apprehension from working underneath the eye.
Thank you, Dr. Yamin. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on under-eye dark circle correction. So what is the recovery time after something like a laser resurfacing?
Yeah, that's a good question, and a lot of people, they don't know that there's a process in that. So you have first of all, you have to prepare the skin before you're hitting it with the laser. You cannot just directly hit it, and especially if you have a little bit of pigmentation, if you have a certain skin color, you have to prepare that skin. You have to make sure that there's no sun damage and sun exposure to that area. Then after that, you're going to go through a period of about 2 to 3 weeks, maybe even 6 weeks of moisturizing the skin, and there will be some peeling and some skin resurfacing that's going to happen. Then once that settles down, then you are going to provide the skin with the building blocks to regenerate, meaning growth factor serums and other products, which that goes for another couple of months before you actually can start seeing the result of it.
And how long does a procedure like this last?
It depends if you actually take care of your skin. It should last many years. But again, if the main reason why you got the under eye discoloration still exists in your life, meaning stress, poor sleeping habits, poor diet, then this won't last more than a year. Then you're going to go back again, and you're going to have the same problem again.
Yeah. And is it going to change the texture under your eyes? Is any of that going to be affected?
Yes, the laser can do that. Laser microneedling can do that. Fillers won't, obviously.
And how would you help someone decide if they're a better candidate for fillers versus the laser resurfacing?
So I address the main reason. I look at the anatomical structure and just listen to the patient and see what exactly is bothering them. Is it the shadows that casted by the tear trough? It's the discoloration of the eye. If they're not happy with the texture and the wrinkles on the eye, then you can decide which one you can address. I don't jump into fillers right away. A lot of surgeons, a lot of injectors, they try to put the fillers because they are not permanent, so it's easy. You can put it in and they will go away. But in my mind, I would like to get it right from the first time around.
And I know you've mentioned, there's several different ways. What is kind of like the ballpark costs for all these different procedures?
So it depends on what you're addressing, how extensive, how many treatments you're looking for, and also depends on the where you're getting your treatment. In my practice in Beverly Hills, if we're doing maybe like fillers only or skincare and fillers, you're looking around maybe $2,000-3,000 in that range, maybe 4,000. Laser sessions will require, again, also some skincare, maybe one session, maybe two sessions. So we'll fall into that same range. Now, surgical procedure will be a little bit more pricier than that.
And do you offer any financing options for these?
We do, and we're very thankful that we actually have the ability to do that for our patients. Not all our patients come financially prepared. They probably spend a lot of time, many years, wanting this procedure, wanting to look good, feel good about themselves, trying to save some money, but sometimes with life, economy, markets, you're not going to be able to hit that number. So here when you can use financing options like CareCredit, where we can bridge that gap for them and help them with the process.
So what would you say is one of your most favorite memories or favorite things about your job?
It's always very satisfying when you actually see how happy your patients about the result that they got. It is a little bit nerve-wracking, and there's some excitement. The patients come in, they want this, but they are also a little bit anxious because you have only one body in this lifetime, and you want to make sure that you take care of it and you get the best result of it. You don't want to gamble with it, right? And walking them through the process and finally see the smile on their face when they got these results is almost like the climax of the whole journey.
Well, I think they're in very capable hands with you.
Thank you.
So thank you so much for giving me all this information and joining me here today. I really appreciate it.
Thank you, my pleasure.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.